AIDS affects nearly all of us in one way or another, so perhaps you can imagine how difficult it must be for a young child who's HIV positive or struggling to cope with a parent dying of the disease. Ryan Gembala and Garrett Gravesen have made it their mission to improve the quality of life for these children right here in Georgia. The organization is HERO, Hearts Everywhere, reaching out for children. We want to welcome them to the program today. Ryan, first of all, when we talk about HERO and this program that's helping children, exactly how does it work?
Okay, well, HERO for Children exists to improve the quality of life of children infected with and affected by HIV and AIDS.
What do you mean by that?
Now, historically, HIV/AIDS care has consisted of basic medicine and food and housing in the United States, but quality of life care really is the next phase of the epidemic because the medication has gotten so good where the children can live long, productive lives. So the next question we ask, if they're going to live long lives, will they be able to live as members of society that will thrive, or will they struggle with the emotional health and quality of life challenges? So HERO for Children exists to improve that quality of life and give these kids a chance to have a great emotional health.
Well, you two guys got together, formed this HERO program. Garrett, let me ask you, why did you do it? I mean, have you been affected in any way? Have family members been affected? Why did you start this?
Certainly. We actually went to school together, but I had separate but independent experiences that brought us together. I lived in Africa, worked in an AIDS orphanage, and saw firsthand the face of HIV and AIDS when a little boy passed away, Ryan, down in Brazil. And the one question we ask is, how do average community members get involved in the lives of these kids?
Right.
How do we do this? And we said, you know what? We're going to start a grassroots approach, you know, kind of with a smooth stone and a sling, try to throw it out there and try to make a dent in this global epidemic in the way that we knew how, which was quality of life care, bringing everyone together, which we think is the next phase of the epidemic, outside of food, medicine, and housing. What happens once they get the medicine? How do we improve their quality of life? And how do we bring everyone make that
because
happen?
These children are facing a lot of different difficulties. Kind of run through the laundry list. I mean, a lot of them don't have parents. A lot of them live in low-income housing. Their families that they do have don't have a lot of money to support them. There's a lot of anger, lack of communication. I mean, they're dealing with so many issues.
So many things, and that's why our programs are so important. We have the Superheroes Mentoring Program, which is a one-on-one mentoring program to provide consistent support in the lives of these kids. It's been designed specifically for the needs of children dealing with HIV and AIDS. We also have the Rising Heroes program, which builds life skills around the emotional, social, educational, and financial challenges that these children deal with. And they're so tremendous. And that's why it's so important for the community to get involved, because we've created a bridge that exists between children affected by AIDS and compassionate citizens of the community.
Well, give me an example. I mean, Garrett, how have you seen lives change? 350 children have gone through this program.
Right.
What have you seen happen?
Yeah, I mean, for example, we do big events, local impact, you know, a child. 10% of our kids have lost one or both parents to HIV or AIDS. What does that mean? It means the fact that they need people to step up and become role models. And I think that's what we've designed a way that everyone in any city, state, community, potentially country out there could really get involved and help these kids in measurable, easy ways through mentoring, through life skills, to give these kids the opportunity to thrive and survive because they don't have much. It's poverty, it's this disease, it's all these cards stacked up against them.
Exactly. And so you're hoping that your plan, what you're doing here in Georgia, can be used in other places throughout the nation.
Essentially so, and we think that, you know, we've really designed this with, you know, help and guidance from, you know, people, the Emory School of Public Health, and we have the CDC in the backyard. Atlanta's a great city to make this happen, and we know this can be kind of a bridge to the rest of the world, hopefully one day around HIV and AIDS.
350 children, that is not a bad start since you founded this organization. Thank you both for being here on such an important day like World AIDS Day.
And we really would like to encourage everyone to visit www.heroforchildren.org to find out about these programs and how other people could maybe learn about it and get involved.
Absolutely. Thank you both.
Thank you.
Well, our Josh Levs is surfing the web this morning.